All right. If you're in the healthcare industry or supported in any capacity, here is some of what you need to know about the president's new executive order related to tariffs. On April 2nd, the White House announced a 10% baseline tariff on all imports, with higher country specific tariffs targeting nations with substantial trade imbalances with the U.S. This isn't just a policy update, it has the potential to impact various facets of healthcare. So let's break it down into four key areas: medical devices, pharmaceuticals, providers and payers, and the vendors who serve them. So, starting with medical devices, imports from countries like India and Malaysia are now facing tariffs up to 27%. This substantial increase could significantly affect companies relying on these supply chains. For example, a major surgical glove supplier experienced a significant drop in share value following the announcement. So, healthcare providers dependent on imported medical devices should anticipate increased procurement costs and potential supply chain disruptions. The Advanced Medical Technology Association has expressed concerns about these tariffs. Scott Whitaker, the president and CEO, stated that such tariffs could act like an excise tax, negatively impacting innovation, costing jobs, and increasing overall healthcare costs. He emphasized that industries with a significant humanitarian mission, like medical technology, have historically been exempted from broad tariffs. That's interesting. Well, on to pharmaceuticals. The good news is that finished pharmaceutical products are currently exempt from tariffs. However, raw materials and active pharmaceutical ingredients, especially those sourced from countries like China, may still be affected. This could lead to increased production costs, potentially impacting drug pricing and availability. Now, for providers and payers, rising costs in medical devices and pharmaceuticals could put additional pressure on operating budgets. This might translate to higher premiums, reduce investments in innovation, or challenging decisions regarding care of delivery priorities. And for those of you who are vendors, if you supply products or services to the healthcare sector, your cost structures may be affected. If you've not done so already, it's a good time to reassess sourcing strategies, pricing models, and operational plans to navigate this evolving landscape. Also, there's growing concern that U.S. service companies, including healthcare consultancies, clinical research organizations, and software vendors, could face reciprocal tariffs or restrictions from international partners. If your business relies on international clients, it's definitely a good time to evaluate potential risks and consider diversification strategies. So, lots to digest today, and certainly more to come. I wish each of you the best as we navigate this ever shifting healthcare landscape.